All right. Hey, everybody, and welcome to the Tuesday night webinar. And Dr. Andy Barlow. I am a graduate of the Carrick Institute of Functional Neurology. Also, I'm a graduate of the American College of Functional Neurology. And a couple of things I wanted to give you some heads up on. Number one is if you have any questions tonight, either type them out or either at the end, I will do my best to open up the floor for any questions. Now, these questions, it kind of gets a little bit irritating sometimes because I come on here and I spend 30 minutes explaining neurological concepts to people and how to monetize this. And then at the end, I get nothing but cricket. So if you have a question, just write it down, or at the end, just unmute yourself and ask it. I mean, if it's a stupid ass question, I'll tell you it's a stupid ass question, but more than likely it's not. Okay. So because we're all here to learn, I'm here to learn. I'm giving the seminar. So from a functional medicine, functional neurology standpoint, I'm probably a little bit further ahead than most of you, but I don't know everything. So if you have a question about marketing, communication, neurological exam, what blood test to run, that's what I'm here for. Okay. You see my upcoming seminar, and I'm going to go over some of this here in just a minute. So one of the things that I wanted to talk about tonight too is in the near future, I'm actually going to be giving an online learning of, and I'm going to call that the Unforgettable Neurological Exam. And so what this means is that we do a functional neurological exam on the patient. Actually, it's a neurological exam that we learned in chiropractic school, but nobody actually knows how to do one. Even medical doctors don't really do exams anymore. They base everything on MRIs and x-rays or whatever. But in this exam, I'm going to show you, what each one of the concepts means when we do the exam and actually how to communicate with the patient. Here's the deal. If you're doing a protocol and you're putting people on somebody comes in with peripheral neuropathy and you put them on the same program, it just means you don't know what the hell you're doing. If you got somebody with a knee problem, you're putting them on the same program. You got 10 people on the same program and protocol. You don't know what you're doing. You don't understand the mechanics of the mechanism is what I'm trying to say, because I don't have people on the same program. I mean, I've got husband and wives in here with early onset cognitive decline, and they're not even on the same program. Husband and wife with the same types of condition, because one has knee and hip problems, another one might have peripheral neuropathy and balance disorders. So, and then they still have cognitive decline. So we have to address all of those. So, and we're going to do an unforgettable neurological exam that makes almost every patient understand why they're in your clinic and why they want to do your program. And the way that you open up your exam set the tone for the rest of the exam and if a patient will accept care or not. So let's just talk about that just a second. We don't take insurance in my clinic. So we start the tone with that when patients call into the clinic. My advertisements that I do on TV states that it's $197. So when you call my clinic, and you can do this, don't call from your chiropractic clinic and try to do this, but grab your cell phone, grab your CA's cell phone and call my clinic tomorrow. I can give you the phone number, 662-844-1414, 662-844-1414. And it won't matter if somebody on here tonight is from Connecticut or if they're from Oregon. You know why? Because we already have patients that come in from those areas. So just call in the clinic and say, I'd like to set an appointment. And within the first 2 to 3 sentences, my staff will tell you that in this clinic, we do not take insurance. Okay, so see, we're setting the tone right there to let people know this, like, look, if you're coming into this clinic, your health is your responsibility and you're going to have to pay for this, okay, out of pocket. So see, we set the tone right there. And then when we go into the neurological exam, we set the tone. And I'm going to explain how I do that just with a shoulder patient that literally started up 2 weeks ago. And you got to keep in mind that the neurological exam is interactive. If you're the one doing all the talking, stop doing that. You've got to ask the right questions, and you got to get the patient involved. And you should be asking more questions. And I'll show you how to do that with some of this tonight. The breakdown of the exam is what's the problem, and I don't mean the blinky light problem. I mean what's the actual problem. Like this afternoon, I had a lady come in, bilateral knee pain, back pain. All right. And then I see on her x-ray, she's got all this gas in here. So I go into the exam room and I go, okay, we've got knee pain and back problems, and we can't address your knee problem and actually optimize the recovery of your knee till we actually address the back problem. And she goes, but my back's not bothering me that much. And I'm like, I completely understand that, but L4 and L5 has got literally like 30 to 40 years worth of degeneration. And those nerves that come out of your back, they control your knee and they actually control your foot function. So she was having back, bilateral knee pain and left foot problems. And then I said, well, what about your gut? And she goes, well, I've got ulcerative colitis. And so see, that patients don't connect ulcerative colitis with this inflammatory process in their gut going over into their entire body. And see, that's your job to connect those dots. And so now this person has to get on a metabolic program. They got to get on an office program, a PRP program, if they're approved by, our medical doctor. But see, those are the things that we have to do to repair, restore, regenerate the joints, the body, and the gut. So we got to get a metabolic program going, the in-office and regenerative medicine going. So again, the problem is just, you heard me say this multiple times for people that's been on here, just stop looking at the blinky light and look at the whole body. And please understand, nobody that comes into your clinic that has chronic pain, nothing is in isolation, meaning they don't just have knee pain. From a chronic health standpoint, if you actually believe that, you're like practicing in 1970 something, and I mean the early 70s. Because all of these inflammatory processes don't just go to their knee or their shoulder or their hip or their back. If you'll just simply ask somebody, tell me about your focus, attention, and concentration, your anxiety, your depression, your insomnia. Tell me about your gut function. Do you have gastric reflux? Do you have bloating, distension, constipation, diarrhea? And you can see all of that on their x-ray. If you see the gut function with dysbiosis, you can see the black holes, if you will. That's what I call them. And let's see. You need to explain to the patient what you found and what it means neurologically and metabolically as well. I've had people come in here in the last month that they were truly, it only happened one or two times, but it was truly a metabolic disorder that was causing the neurological problems. And see, if you don't know that and you don't take x-rays and look at patients, this person had been to two or three chiropractors, medical doctors, physical therapists, and structurally in their spine, they had zero, literally it was like a perfect spine, and yet they had all of these neurological disorders. And see, the only way you can explain that is through metabolic care, is metabolic issues, blood sugar, inflammation, kidney, liver, autoimmune disorders is triggering these metabolic disorders, and we have to address you metabolically. But see, if you have a hammer, everything looks like a nail. If all you do is adjust the spine, then everybody's spine needs to be adjusted. Okay, we've got to get outside of that kind of thinking. And then the solution with the breakdown is three parts: metabolic care, in-office care, home therapy, and if they need regenerative medicine, that's what we'll do if they're approved by our medical doctor. And what's going to look like if they accept care and do care, and then what's life going to look like if they don't do care. Okay, so the best thing I can do really to just wrap this up right here is I'm giving a seminar in Conroe, Texas, on November the 11th to the 12th, and it's going to be on frozen shoulder. And that's really what kind of, if you will, sales doctors to come to the seminar, is to learn how to unlock these shoulders in 1 to 2 visits. And if you don't get the shoulder unlocked in 2 visits, then we give a patient a full refund. Most of you have heard this before. I've had to give back 4 refunds in 1 year. That's the most I've ever had to give. But let's talk about a patient that came in 2 weeks ago. This is a real live patient, and she came into the clinic and she's got a shoulder problem. Not frozen shoulder, okay, but a shoulder problem. Now, all right, so she comes into the clinic with shoulder problems, and then my staff knows to take x-rays of both shoulders, side view of the neck, and we actually took side view of her low back. All right. Now, the reason we did that is because we want to look at all the structural possibilities. And I know the lumbar spine does not go to the shoulder. Okay. But we want to look at, she's got a shoulder problem. Is it due to some kind of injury? If it's an injury like a whiplash injury, it's going to impact her neck and her low back. All right. And so because of the whiplash injury with the snap back or the side impact or the frontal impact, that acceleration, deceleration is going to impact has the potential to negatively impact both cervical and lumbar spine along with the concussion. All right. So I look at her x-ray, look at her back, and then she's got C5 degeneration and L5 degeneration. Hold on just a second, let me turn that off. Okay. And so the combination of that, if you look at the cervical spine at C5, look at L5, and you go, wow, both of those look like on x-ray that they've accelerated in the degenerative process at about the same rate. What could cause that? Well, some type of trauma into the spine, like a whiplash injury. So I went in and I asked her, I said, before we get started, tell me about your first car wreck. And she goes, well, I've never been in a car wreck. And then she goes, whoop, hold on a second, wait just a minute. When I was 17, we had a car wreck. Okay. And then I asked her what happened. Okay. This was a frontal impact. Okay. And then I said, and if most doctors wouldn't even ask that question. All right. And then what did I ask next? I said, tell me about your next car wreck. And guess what happened? At 22, she had a second car wreck. And without looking at her paperwork, I can't remember if it was side or rear impact. Okay, then tell me about your third one. She's only had 2 accidents. Now remember, these car wrecks are cumulative. And she goes, what does my car wreck have to do with any of this? And I go, that's a really great question, because when you have a car wreck, that's not a linear problem, it's a cumulative problem. So the first car wreck caused a certain amount of damage. The second one didn't cause linearly, it was exponential in the damage that it's causing to your body. And unfortunately, it's taken almost 30 years for you to start to have symptoms. Now she's had shoulder problems for a few years, and she went to 2 chiropractors, at least 1 physical therapist and 1 medical doctor. And guess what happened? Everybody's looking at her freaking shoulder. And I did an x-ray of her shoulder. She virtually has 0 freaking degeneration in her shoulder. Okay. And this is what drives me up a damn wall with these doctors. Okay. Patient comes in with shoulder problems, and what do? Look at the shoulder. Well, yeah, of course we need to look at the shoulder. And I looked at her shoulder, but she has virtually 0 degeneration in her shoulder, and it's coming from her neck. And this is where the communication comes in. And this is why, if you don't know the mechanisms, and if you don't know what underlying, looking at things metabolically, neurologically, and you're over here just pounding down the shoulder, we know that at C5, which is the area that's most degenerated in the neck, go to the shoulder. I asked her about a rhomboid. I said, tell me about yours. She's like, oh yeah, that feels like almost like a numbness back there. She had that nowhere on her paperwork, because she was so focused in on the pain, she wasn't really worried about the numbness. And we know that if you draw out the brachial plexus, we know right off the C5 nerve root, you have the dorsal scapular nerve, which goes right to the rhomboids. So rhomboid problems, shoulder problems, all of the muscles that come, or the nerves that come out of your neck, control all of your muscles in your shoulder except for 3. And then we did an exam, and oh, by the way, she's having numbness in her hands as well. Didn't put any of that on the paperwork. And then because I tell them it's C5, then we go down to C6. This is C6. Any numbness here, any numbness here, any numbness there. And she's like, yes, in all of those areas. So now we've just from this one standpoint taken shoulder pain, turned it into a neck problem with a rhomboid problem, and now she has numbness in her hand, and the only thing she complained about was her shoulder when she came in, and with a little bit of neck pain. And then I go down to the back and tell me about your back, tell me about your feet, and all that. So fast forward 2 weeks, and she'd gotten such incredible, remember, she'd gotten 0 results from everybody else, from all the other doctors she went to, because everybody's looking at right there, a blinky light. Nobody's addressing the actual underlying problem. Now, she was one of those unique individuals that actually only did a 10-week detox. You know why? Because even though I know she's had head trauma, which could lead to a leaky gut, and I didn't see any of those things. And just because you've had a head trauma, it doesn't mean that 100% of people are going to get a leaky gut from that. Just almost everybody does. But I didn't see anything in any other areas of her workup that just said, look, you need this entire gamut of blood work. And I just didn't see that. So we neck, shoulder, low back, and then feet. And then we did do a 10-week gut detox to dampen some of the inflammatory processes in her body. So 2 weeks, incredible results. She's like, I got to get my daughter in here. So her daughter's 18 years old, young girl. And actually, the crazy thing is her daughter's in worse shape than she is. All right. And people want to know what's going on here. And I said, well, you've got these kids nowadays that what do? they're eating crap basically from the time they come out of the womb. Okay, maybe they've had mom's breast milk for 9 months, and everything after that they're eating crap. And then once they get teeth, they start eating McDonald's, Cheetos, Cocoa Puffs, all these fast foods, and now what would take somebody 45 or 50 years to neurodegenerate, now these people, this is happening at 18, 19, and 20 years of age. All right, so and this girl has neck pain, back pain, numbness in the hands, numbness in the feet. Her hands, when we do the temperature, are cold. Her hands are actually blue on the thermal scan. Her feet are blue. And see, this is what's important. I take the thermal scan. This is why I tell doctors, you got to get you fixed. Because I took the thermal scan and I go, what color is my hand? And she's like, red. And I'm 40 years older than you. What color are your hands? Blue. And I had shoes on, so I didn't take my shoes off. But the point is, see, when you maintain optimal health, you can gauge yourself to everybody else. But a lot of doctors that come to my seminars, they're in piss poor health. Okay. And they're not leading by example. All this blood work that I recommend patients get done, I've already done all of that. I've done all the blood work. I've got me fixed. Okay. So I'm not the guy saying, do this, and I'm not going to do it. I've already done it. My wife has already done it. We are here to lead this healthcare revolution because doctors just don't know how to do this. Okay. If you're a chiropractor, most of it's pop and pray, the one cause, one cure. And then from a medical standpoint, it's couch postulate, which is basically the same thing in chiropractic, one cause, one cure, where you take something like bacteria, you put it in a petri dish, and we find an antibody to kill it. And then see, we use that for acute care, but that doesn't work with chronic health problems because there's so many different variables with this chronic health issue that's going on. So see, the problem with most of you here, you would just look at that blinky light. You would do the same thing everybody else did some movement stuff, probably try to activate or manipulate the shoulder, put them on laser, and it's like, oh, can't figure out why this is not working. Okay. And you're not addressing the neck because you didn't do a neurological exam, you didn't address the gut because you didn't ask any questions because you're over here looking at the busy light, the blinky light, because you're too busy trying to close the patient instead of trying to actually improve the quality of their life. Okay. So this upcoming seminar that we're going to be giving, it's going to be on frozen shoulder. In my clinic, if we don't get results in 2 visits, I don't accept your care, period. And then my frozen shoulder program, just for that 2 visits, is $4,950. And I figure if I can fix something nobody else can, then I got to get paid for that because I spent years of my life learning how to do this and perfecting this. All right. And then the entrapment syndromes in your neck, there's 3 of those that can actually cause problems in your hands. And then each one of the nerves that come out of the peripheral nerve that come out of your brachial plexus, your median nerve, ulnar nerve, and radial nerve, they actually have 3 entrapment sites. So we have to know which one of those areas may be entrapped and how do we release that. Also, we're going to be talking about muscles in the cervical spine, posterior and anterior, how to test those muscles for length and strength. If they're weak, how do we activate them? If they're too short and need to be activated, how do we do that? So if you're doing your chiropractic adjustments, if you activate the muscles that are weak, and then you activate the muscles that are too short, and you get that synergistic function, then you can actually, that adjustment actually works a whole lot better doing it that way. So anyway, that's what's coming up in November the 11th, 12th. 11th and 12th. It's going to be a 2-day seminar, so buckle your seatbelt in. You will be able to, on Monday morning, when you go back to the clinic, you will be able to address these frozen shoulder syndromes. We'll show you how to do that. We'll show you how to market that and get videos, what to do with your patients, to get it videos so that they can go online and look that up, and just for patient testimonials. So what I'm going to do is I'm going to open up the floor for any questions. I have 7 minutes on the timer, so I'm going to open up the floor for any questions. So please unmute yourself if you have any questions and let me know what's going on.
Hey, Dr. Barlow.
Yep.
This is Randall. Hey, so when you open up your exam and you bring them into the room, and because you were talking about how you know, the expectation from the front desk, you got them. When you bring them in, is there something that you say to pretty much everybody specifically to open up that conversation right there?
Well, one of the things that I do is I introduce myself. And I'm telling you that, and this is one of the things that separates me from every doctor that's watching here and every doctor in chiropractic. It's like I have TV commercials that I run, and I invest about $16,000 a month on my commercials. And guess who's on those commercials? This guy right here. And I don't have it in with me right now, but I've got 2 #1 best-selling books, and I can show any doctor on here how to get this, to get a #1 best-selling book. So I've got marketing on TV with all these testimonials. And then Randall can help you with that too, with the marketing that he does. And he can, if you want to text him or send him a link here, you can do that. But he has marketing that he does as well. But see, when people come into my clinic, they already know I'm the shit, okay, without me actually having to tell them that, okay. And so because I asked them, I see it on there that they've seen me on TV, and I go, Miss Smith, I'm Dr. Andy Barlow. I want to give you my first #1 best-selling book. And then when you finish that, I've actually written 2. I've written a second #1 best-selling book. And then what we're going to do in the clinic today is we're going to ask you some questions. We're going to do a neurological exam, and we're going to figure out together how we can actually optimize your recovery. And I promise you, if I can't help you, if I run into a stumbling block and I see that you're not a candidate for care, I'll let you know, and I won't charge you for today's visit, and I'll refer you out to another doctor. And last month, this is November, and last month I did refer out 2 patients because they were just too far gone. There was nothing I can do for them. And I don't apologize for that. It's just some people just come in. There's probably going to be 2 or 3 people this month that come in. They're either going to come in with some type of Parkinson's and they're too far gone, or some kind of Alzheimer's and they're too far gone, or somebody's got a busted up knee or hip and they're too far gone, or somebody might come in and say, I've got neck problems. And then now it's like, man, just like you got some cervical cancer in there or something. Of course, I'm not going to tell them that, but they're going to have to get a referral out. Okay. So, so those are the things that I do is I introduce myself. I give people my book right out of the gate. I'll let them know that I'm going to be asking you some questions. We're going to be doing a head-to-toe neurological exam to find out what's wrong neurologically, and then as I get into the program and I go through the OPQRST, and we get to to rank the what level of pain that you're in. With that, I need to know, like the lady that came in today with her knee, she was having a difficult time. She didn't have a problem telling me how much pain she was in. She was at a 7 or an 8. But when I asked her, what number do we need to get this to for you to be happy with the results? See, nobody's ever asked her that before. And see, I've got to have a number. We can't even move into the neurological exam. We can't even move to the next step till she gives me a number, because I've got to have a realistic expectation of what do you expect out of this clinic. And see, nobody's ever asked those patients that before. Everybody's wanting to be something unique or something special or something different. Well, that's just one simple thing that you can do, is just say, on a scale of 1 to 10, 10 is so bad, you can't, you're in a bed, and 1 is you don't have any pain. Where are you? And then what number do I need to get this to for you to be happy with the results in here? And you're going to be surprised. Most people don't even expect to get out of pain. They've been so mismanaged and so manipulated and so misused by the healthcare industry that if they just get to a 3 or a 4, they'll be happy with it. But I tell them, if there were a way, I'm not saying we can get you to a 1, but if there were a way we could get you as close to a 1 as possible, would you want to know about that? And then once they say yes, I've never had a person say no with that, but once they say yes with that, then see, that gives me the opportunity to do a head-to-toe neurological exam and then go over everything that I find that's wrong with them from a neurometabolic standpoint. So those are the things that I do that's the same. And then I just let the neurological exam tell me what direction I need to go, what areas of the neuraxis is malfunctioning. And then also, here's the metabolic programs that we need to do in order to optimize your recovery. So, and see, if you're again, if you're not doing metabolic care, this is going to hurt some of you, but if you're not doing metabolic care, I'm just having to ask you, what the hell are you doing? It's because you're not able to address the underlying metabolic conditions with glucose, blood sugar, inflammation, autoimmunity, liver, kidney, hormones. And I mean, it's a one-hit wonder. And if you don't change gears, you can't play in my world, because if you wanted me to consult you, I wouldn't even do that if you couldn't shift gears into this neurometabolic care. Because again, that's, that popping and praying and banging bones, that's 1960 stuff. That's not even 1970s. Okay, chiropractic has kind of moved on beyond that. We've gone beyond the rotary dial phone, and lo and behold, we actually have an iPhone now, but chiropractic has stayed in the rotary dial phone. So I got less than a minute. So if you got any more questions, please ask me. I'll try to answer as quickly as possible. But I got less than 1 minute on the counter. But if you guys have any questions, you can go to info@barlowbrainandbody.com. That's info@barlowbrainandbody.com. If you have any questions, you can go on there, ask the question. If you have any particular types of webinars you would like or for me to go over, please put that on when you email me, and Randall put that up there for info@barlowbrainandbody.com. I'm about to get shut off here pretty quickly, so I want to thank y'all, and I'll see you next week. Have a great week, everybody.